Hello everyone. It's good to be with you again. As many of you know, I've been with you now for just over a month as your medical center director, and it's been an absolute pleasure for me to be here at Central Texas Veterans Healthcare System. I've had a number of transition briefings in the last month, meeting with staff that have had the opportunity to come in the office here in Waco and Austin, travel to a number of our community-based outpatient clinics to interact with you and learn what's important to you and what you think my early priority should be as your director. I've also had the opportunity to meet with leadership in the organization. This includes physician leaders, nurse executives, nurse managers, administrative leaders, so that I can get a really good idea of where we think the strengths are in our organization and where the opportunities are for improvement. In those sessions, what I shared with you is that I was going to take in all of your feedback, and after I had a chance to prioritize it, I was going to share with you my plan for our organization over the next 100 to 180 days, depending upon the scope of some of the priorities that you identified and that I agreed with for us to operationalize over the course of the remainder of this fiscal year. So I'm here to share with you today that plan, and it is a 180-day plan that I consider to be very aggressive to position the Central Texas Veterans Healthcare System to be the provider of choice for veterans in our market. So what I'd like to do first is hit some of the highlights of those priorities that you shared with me during those transition briefings. And I've broken them into pretty basic categories that we can all generally understand. So here are the things that you shared with me during my transition briefings. What I'm focusing on here are some of the areas that you all identified as opportunities for improvement. The first was what was defined as consistency, and there was an impression that across our healthcare system that we maybe operate in silos and we don't operate as a family as we should, and that did resonate throughout all of those sessions. I also heard a lot of feedback about accountability and individual accountability, service level accountability, but there was a general sense that our organization could be a lot stronger if we had a culture of accountability throughout. So we'll talk more about my priorities under the umbrella of accountability. There was also some feedback I received about improving the veteran and employee experience. This focused on employee engagement, improving customer service in our organization. Also, we'll talk about some of my specific priorities there. We also had a lot of feedback about scheduling and how as services we could improve our scheduling practices if we were given the opportunity to take more ownership of those scheduling practices. So we'll talk about that. There was also feedback about structurally getting things done. And in my particular plan, you're going to see comments about engineering service because some of the feedback was specifically about our engineering department and what we could do to give engineering better feedback about how well they were meeting our needs. And meeting our clinicians' needs and our administrative staff needs to repair things throughout the organization. I also got feedback about our recruitment and onboarding processes, and many of you felt like we had some opportunities for improvement there, so we'll talk about that. There was also discussion about our strategic planning processes, and that this again was an opportunity for improvement, as well as how well we do or do not use our space. There were additional comments about housekeeping, and perhaps an ability to enhance our housekeeping services to ensure that our organization always looks its best. And last but not least, I got quite a bit of feedback from our employees about their varying perceptions of the relationship between our labor partners, being AFGE, and our local management. So I did identify some specific priorities there. So we'll go into a little bit more detail under each one of those categories that I just summarized for you. So first, under consistency or operating as a healthcare system, I have been really impressed with the ability for the Central Texas Veterans Healthcare System to operate 3 large sites, which is relatively unique. Those 3 sites being obviously Temple, Austin, and Waco. But what I also identified is inconsistency in leadership structure at those sites, specifically that we have an assistant director, Amy Maynard, who's doing an outstanding job at our Waco campus. We have a deputy chief of staff here, Dr. Hussein, that does have responsibility for the Waco campus. But we did not have the same level of leadership at our Austin location. Austin is a growing, booming location. If you haven't been there, I really would encourage you to go look at that outpatient clinic. It's beautiful. But with Austin being a large part of the Central Texas Veteran Healthcare System's growth and future, I really thought it was time for us to put the appropriate level of leadership there. So I am actively working with Human Resources now to classify an assistant director position, and we're planning to relocate that position in Austin. This will be the position that your current associate director, Andrew Garcia, previously occupied as the assistant director for operations here in Temple. Again, the plan is to relocate that position to Austin, and activities to do that are actively underway now. We also already had a Deputy Chief of Staff position that was approved for the Austin location. We've been unsuccessful to date filling it, but again, in partnership with Human Resources, we're looking at other recruitment avenues and looking aggressively to fill that position, and that will put our campuses create some parity, so that we'll have an assistant director both in Waco and in Austin, as well as a Deputy Chief of Staff coverage at both of those sites. In addition, as part of this restructuring, I am going to be changing services that several of your senior leaders supervise. We'll be talking more about that with those services that are affected. But to summarize it for you, our assistant director in Waco is going to be picking up some pretty significant services. In addition to engineering, which Amy already supervises, we're going to be moving some of the other facility services there. And by facilities, I mean environmental management service. Ms. Maynard is going to be picking up responsibility for, and she's also going to be picking up a supervisory responsibility for nutrition and food service, which she already has, but she's gaining safety and emergency management. That will create an assistant director for facilities in Waco, and we're also making some changes to our associate directors, supervisory structure. Employees that are currently working in our patient administration service, which is a department aligned under our chief of staff, are going to be realigned under the associate director. So a few more moving parts, but we want to be certain that we're sharing the load and that all of our services have a senior leader that can be actively engaged in their activities. So we'll be notifying other services that are affected by that realignment. Another item that I've identified in my 180-day plan under consistency is specifically related to how we function in primary care across our system. So obviously we've talked about the large sites here in Temple, Austin, and Waco. Haven't gone into as much detail about Cedar Park and Palestine and Brownwood and the other community-based outpatient clinics. What I've identified is variance in how we see our patients in primary care, variance in wait times for patients, and panel sizes. So I put together a really aggressive performance metric for your chief of staff and for your associate director for patient care services, Mr. Sisk, focusing specifically on what we're calling PACT optimization. This is focused on improving our veterans' experience in primary care, ensuring they have timely access, and the specific target is 25%. Now what does that mean? That means I'm expecting by the end of this fiscal year, 25% of our PAC teams, which are primary care teams, including physicians, nurses, medical support assistants, pharmacists, etc., 25% of those teams to be defined as optimized. And optimized means they have a third next available appointment within 7 days, and they have panel capacity between 80 and 100%. So again, we're going to be talking more, obviously through our chief of staff and primary care, on this primary care optimization, but the idea here is to standardize how we do business in primary care, function as teams, and ultimately improve the veteran experience. So I'd encourage you to touch bases with Dr. Fashina and Brian Sisk and learn more about what PACT optimization means and how you can play a part. The other area that I've identified in my 180-day plan under functioning consistently relates specifically to provider productivity. Our new secretary is a physician. And one of the things that he's also identified as a priority is improving physician productivity. As I've looked across our subspecialties in particular, I have identified some opportunities for improvement, which really is going to require us to look closer at how we're practicing both here in Temple and Austin and Waco and our community-based outpatient clinics to ensure that we're utilizing our really most expensive human resource as efficiently as we possibly can. I've already had a number of discussions with our chiefs of medicine and surgery and mental health who are actively engaged in this project. And we've got about 4 subspecialties in particular that I'm going to be taking a really close look at to ensure that we're maximizing productivity there as best we can. Those specific subspecialties are ENT, dermatology, vascular surgery, and urology. And again, we've started those discussions. I look forward to their success in improving their productivity. Another area that I mentioned to you earlier that the staff raised to me was about scheduling. And I chartered a team to evaluate what is currently defined as medical administration service to see if there's an opportunity for us to improve scheduling accountability in the team environment in our outpatient clinics. That team had its meetings over the past 3 weeks and has put together a proposal for me that does recommend realigning our outpatient clinic staff and having medical support assistants that currently work in clinics such as primary care, mental health, surgery, medicine subspecialty clinics, and they have proposed and I've approved a realignment of those medical support assistants to the clinical services that they're currently supporting. We'll be actively engaging our labor partners in that transition, but those staff that are affected will hear more about this both for medical administration service and for the services that they're currently supporting and will soon be reporting to. Next was engineering. So I did talk about your comments related to timeliness of resolution of concerns. So in my 180-day plan, I've set an expectation that we're going to develop a new customer service survey, specifically for our peers in engineering, to give them more real-time feedback from the leadership level about how well they're meeting your needs. Our Assistant Director, Amy Maynard, is going to be working on that effort to finalize this survey, and we'll give engineering an opportunity to see how well at the service level they're meeting your expectations to do everything they can to improve your perception of how well they're resolving your concerns. I've also approved a very aggressive facelift initiative here at Central Texas Veterans Healthcare System. For the next 180 days, we're going to be focusing specifically on the Temple campus with the expectation that next fiscal year we'll be looking at other locations such as Waco. But what this is going to include this year is aggressive replacements of waiting room furniture, of inpatient room furniture. We're going to be doing a lot of halls and walls repairs. So pulling up some of the tile you see around the Temple campus and continuing some of the hardwood laminate that you see on the floors and putting up new paint, artwork, etc. Just modernizing our facilities as we continue to strive to be the veterans provider of choice. So you may see some construction projects occurring both in the days and in the off tours because engineering has put together a very aggressive proposal that I've approved to get as much of that done over the next 180 days as possible, and I look forward to their success. Under customer service and employee engagement, another concern that you raised, we are going to be starting a new rounding program. I'm really excited about this one. We've learned a lot from St. David's in the Austin market about a rounding program they put together with their organizational leadership, where you'll see service chiefs, you'll see assistant chiefs, rounding throughout our organization at all campuses, talking to our patients, talking to our staff, ensuring that we're meeting your needs and doing everything we can to do so, and then tracking and trending your feedback to ensure that we're resolving the concerns that you raise in a very timely manner. I expect that rounding program to be deployed sometime around June 1st. It's currently being managed by 2 executive councils that we have here. One is the Customer Service Executive Council, as well as the Workforce Executive Council. And those chairs will be deploying that by June 1st. And again, looking forward to their success. I'm also going to be holding some focus groups. Some of you may be aware of our all-employee survey results. Some may not be. I've actually arranged a briefing with myself and our labor partners to re-review our all-employee survey results. And together we're going to be holding focus groups with those work groups that had some of the lower scores to engage those staff directly and do everything we can to ensure that we're improving their experience as employees here and to put us in a better position with the next all-employee survey to improve those results. I'm really looking forward to those focus groups. We haven't set dates for those yet, but for those work groups that are going to be affected, you'll hear about that soon. In addition to customer service and employee engagement, what you're also going to start seeing is a very aggressive positive media campaign. As VA employees, many of us can relate to turning on the news and hearing a lot of the negative things that are happening, unfortunately, in VA. But what we don't hear enough about are the positive stories. Well, so I'm really excited to have partnered with medical media, to have partnered with public affairs, to put together some positive stories for you, for our external stakeholders, and for our veterans. And throughout our organizations, both here, Waco, and in Austin, what you're going to start to see in our waiting areas are positive stories that we'll be showing on the televisions about good things happening in VA nationwide, as well as good things happening here in Central Texas, so that our customers and our employees can get a more balanced perspective of obviously some mistakes that we've made and owned up to, but more importantly, a lot of the good things that we're doing in the community and the positive impact that we're having on veterans' lives. So please keep an eye out. You'll see some of that media on our homepage, but you'll also see some of it on the TVs in the waiting areas that many of you work in. So human resources and timeliness of onboarding and recruiting was another item I heard from you all about. So we put together some really aggressive onboarding targets for our Associate Director, Andrew Garcia, as well as our Human Resources Department. So I've asked them over the next 180 days to strategize how in FY18, which will start October 1st, the average entry on duty time after you as a manager or as a peer interviewer make it a selection, that within 30 days, the individual that we've selected for that position will be on board. Now, this won't be every position, but I'm asking for the average in the organization to be 30 days. This is a very aggressive target, but I have absolute confidence in your Associate Director and in Human Resources and in many others that are going to have to be involved in this process that we can meet that goal if we think outside of the box. So they've already started those discussions, and many of you should expect to see the positive impacts of their efforts. So rounding it out, I've got a few more. Facility planning was another area that you all brought up to me, more specifically strategic planning and appropriate use of space. We are actually planning a strategic planning summit. That will be sometime likely towards the end of this fiscal year, so between July and September. We're going to pull key leaders in the organization and we'll have a retreat. We'll get a chance to really take a step back, look at our organization, and think about campuses, think about the healthcare industry and where we're headed, but to be certain that we've got a strong strategic plan as well as facility master plan that makes sense and that's going to meet our needs not just now but in the years to come. So again, for those that will be involved in that effort, you'll hear more about it. Environmental management was another area you brought up to me. I have asked, again, our Assistant Director, Amy Maynard, to work with Environmental Management Service and identify any opportunities for us to supplement what our Environmental Management Service currently does, specifically in the hospital in cleaning the organization. So this will be specific discussion with environmental management and our labor partners to identify any areas of the hospital that we may be able to carve out as a service and perhaps have another entity pick up that responsibility for us so that the housekeepers that we do have can really focus on the areas that they have responsibility for. So again, those that will be impacted by that will hear more about it in the months to come. I really want to finish my discussion with you today talking about our management and labor relations. I am committed to a strong relationship with our labor partners. I've had a number of discussions with our locals here in Temple as well as our local in Waco, and have absolute confidence that we've got a strong relationship and will continue to do so. So in that vein, we've agreed to do some joint training, specifically with our supervisors. We have historically provided supervisory training, but it hasn't been mandatory. So we have decided to make that training mandatory. And HR is going to be conducting it in conjunction with our education service. But we're going to be partnering with AFGE and allowing them to both review the curriculum and come in and teach a couple of those courses jointly with our labor management staff to ensure that our staff see us in partnership. Instead of seeing us in different rooms, we're going to be in the same room giving you the same message. And I think that is a very important piece of us ensuring that our organization can make the aggressive strides forward that we need to. So I really look forward to that partnership that we've started, and I have no doubt will continue. Other things that I do want you to keep an eye out for, they're not specifically part of the 180-day plan. We've talked a lot, and I'm sure you've heard a lot in the past about SAIL, which is one of the performance improvement tools that the VA uses. So while I didn't specifically include anything in my 180-day plan about SAIL, those activities are going to continue. We've got some employee educational events and some celebrations coming up related to SAIL. For those of you that haven't heard my announcement, Central Texas Veterans Healthcare System received special acknowledgement from the Deputy Secretary of VA as one of the most improved facilities in quality over the last 2 quarters, and that was measured by SAIL. So we look forward to our continued success there, and you'll hear more from our Quality Safety Value Service about SAIL initiatives and a SAIL Week event that we're planning. And last but not least, there is a very aggressive $10 million spend plan that I've approved with supplemental funding that came to us from our regional office. So part of that $10 million is going to cover some of the flooring and furniture replacements I just spoke to you about, but we've also approved a significant amount of additional supplies, other equipment, including some OR equipment and some new procedure equipment for Austin. So the idea of this $10 million spend plan, again, is to position the Central Texas Veterans Healthcare System to be the provider of choice for veterans in Central Texas. So I look forward to your feedback about my 180-day plan. Again, you'll have the opportunity to engage me in town halls, both virtually and face-to-face. I appreciate everything you do for our organization, and I look forward to working with you now and in years to come. Thank you.